Well, we all sometimes get too busy to look after our own health, but just by getting certain screening tests and practicing healthy behaviors, you can stay healthy at any age. And so this week we're discussing women's health. Right. Here to talk about this subject is Dr. Paula Walker-King. Nice to have you here.
Great to be here, Cheryl. Good morning to you.
Good morning. So first, let's talk quickly about obesity, of course. There are studies that have shown that a growing number of Americans are overweight. So what can we as women do to kind of keep our weight down?
So the main thing we know is that when it comes to chronic disease prevention, we have to maintain our weight. So we've got to watch our calories. We've got to make sure that we're eating a lean diet, leaner meats, chicken, turkey, fish, lots of fruits and vegetables, staying hydrated, and we're making sure that we're moving at least 30 minutes a day on most days of the week. Okay. We've got to do that.
All right.
And that decreases our risk for diabetes, heart disease, and a myriad of other conditions, including cancer.
Okay. Pap smear, what are they checking for and how often should women get them?
Pap smears, they are checking for precancerous conditions of the cervix. They should begin at age 21, and they should be done annually thereafter.
Annually thereafter, okay. What about mammograms?
Mammograms. Now, so a few years ago, there was a bit of controversy. And it was like, oh, do we need them at age 40 or not, or what have you? But there is a consensus that women should be screened, have at least a baseline mammogram at the age of 40. Now, depending on their family history, if it's significant for breast cancer, they will start screening a lot sooner than 40. But by 40, a woman should have a mammogram done and have it annually thereafter.
Okay. What about cardiovascular problems?
Cardiovascular problems, again, annual physical is a good idea for women, particularly starting at the age of 40 and thereafter, because again, it allows for cholesterol levels to be checked on a regular basis, and baseline EKG to be followed, and make sure that there are no abnormalities that develop, and then blood pressure can be regularly monitored. And so those are the things that we look for in terms of maintaining cardiovascular health.
Okay. And I've also seen commercials about different medicines for bone health. Yeah. So what about that? That's very important.
That's very important. So sometimes we forget about our bones. And so bone density test is a non-invasive test that actually tells a woman whether she's at increased risk for osteoporosis. And after a woman hits menopause, she is more at risk for both osteoporosis as well as cardiovascular disease. So we have to make sure that we at least know the risk so that we can implement measures to mitigate the chances of her, developing brittle bones and subsequent fractures.
Part of eating right and exercising, taking vitamins as well.
Taking vitamins as well, avoiding those dark colas or carbonated beverages. They leach minerals out of the bones, avoiding smoking, and just overall maintaining, a sense of, health in terms of these basic things like exercise and healthy diet.
How does a woman know what vitamins she needs to take?
Okay, well, the main thing that women, we need more folic acid. We at least need 400 micrograms of folic acid per day, particularly women of childbearing age. There are certain iron. Women of menstruating age tend to be slightly anemic, so it's important that we have adequate iron levels as well. And so a typical women's formulation, like this women's pack here, would be helpful, or you can find one at your local retailer that has geared toward the nutritional needs of women.
Helping us take care of our health. Thank you so much, Dr. Paula Walker-King. Let's send it over to Elizabeth.
Thanks, Cheryl. Great information there.